So every time I go into the patient's room, I'm going to knock and introduce myself. I'm going to tell the patient, my name is Kristen and I'm your nurse today. And as I go in, I'm going to provide privacy, and I am going to have gathered my supplies. I'm going to wash my hands, and I'm going to identify the patient. She's going to tell me her name, and her name is Alice, I believe, because that's who I've been practicing. But her name is Jenny. I was just kidding. Her name is Jenny, and I say, "You're Jenny," and she says, "Yes, my name's Jenny Lynn," and she tells me her birthday, and I double check it on the bracelet. So I have identified her. I'm going to explain to her the things that I'm going to do, which is just do some wound care for her, and it's just going to be cleaning up and changing her dressing. I'm going to ask her if she has any questions, and I'm going to look at the doctor's orders and double check to make sure there's nothing that I have forgotten as far as the equipment that I need, or if there's anything special that she needs for that. And then I'm going to ask her if she has any allergies to anything, like the tape. It should already be in her chart, and I should already be aware of that, but I'm going to double check. So I've checked the doctor's orders. I've washed my hands. I've identified her. I've provided privacy, and I am going to put on my gloves. And I'm going to get her to a comfortable height for me and make sure she's okay. She just barely told me that she just had her pain medication, because it's important for her to have had pain medication within 30 minutes of me doing this. And she said that it's kicked in and she's feeling good. So I've got my gloves on, and I would put my gloves on before I move this over here, just in case you care. So this is where I'm going to just kind of come in here, and I'm going to just try and make sure that I only uncover what needs to be uncovered. Just kind of making sure that she's comfortable, kind of assessing how she's feeling. Right away when I get her wound exposed, I'm going to just kind of look and see what kind of drainage I can see from the outside. If there was any striking that would have been shown through the ABD pad, whatever it's called. I knew what it is called. Anyway, so when I do this, I've got my garbage by me. Gosh, I did have my garbage by me. It didn't scoot. I'm going to change my gloves because I just touched the garbage. And I'm going to put on my new gloves. Okay, wash my hands, put on new gloves. And I'm going to make sure that I keep all of this within my eyesight. So with this, when I do this, I'm going to just put my non-dominant hand on her wound and just put a little bit of pressure, nothing that's going to hurt her injury. And I'm going to pull away at the tape all the way around, and make sure that if there's any hair, to just kind of do it in the same, pull the same direction as the hair is going, so that it doesn't hurt her. And then I'll just come under here. When you lift up the material or the bandage, try and do it away from the patient so that they don't see what they've got going on underneath. And when I do this, I'm gonna lift this up and I'll automatically assess the taco. This is going to just look for the type, the amount, the color, and the odor of her dressings. So in the instructions, Joy had mentioned that she would use some tweezers of some sort to take this out, and she would just take it and try and assess each layer, because as you go down, it's going to be different on that taco, and put it in here, making sure you kind of look at that for all those things that you need to document later. So you're gonna crumple that up, and you're gonna double glove it, and you're gonna put this in a biohazard bag. So now I'm gonna just do an overall look at it, see if I can detect any signs of infection, redness, swelling, and then also just even look and see how well it's healing. So I've done that, and So I'm going to come to my dressing change box, and when I do this, I want to always open it away from me, trying to avoid any mess that I can and not reaching over anything for my sterile field. So now once I start this, I'm going to have to stay sterile until the bandage is back on her. So I am going to reach in here and grab my sheet that is going to work for my sterile field, only touching that 1-inch border. And I'm going to place that down here. Don't reach over anything, stay away from it. Only the 1-inch borders. I can come over here. These are sterile, so I can get these unpackaged without my gloves on right now, as long as I don't touch anything. And just plop them on there. I would have washed my hands before I opened up this kit too, just as a side note. So that one's on there, and same as this, I can just not touching anything, keep it all sterile, and put that on there. Don't want to have things flying around. I would have done that a lot different so that wouldn't have flopped, but it did it that way because this is the first time I practiced with those things. So I washed my hands again, so now I can come in here with my, and I wouldn't have reached over. I'm sorry, I would not have reached over. I would have come around like this to grab my gloves. And I come over here with my gloves, opening it by just the edges, making sure that nothing's touched. I'm gonna make just a little bit more room for myself because there's never enough room on these things. And nothing is touching. That would not have been the way. Only the edges. So I have got that. I don't want to reach over any of my sterile field, but I don't have any room, and I'm going to, dang it! Come over here. Don't reach over anything that you don't have to. I would have made more room for myself, for sure. So come in, grab your first glove at the cuff, and gloves are old, broken. I would have made sure that they're intact. I've got this glove on. I'm going to come in under this cuff, do the same thing with this hand, and I have got my my sterile gloves on now, and I can just kind of get rid of that by so now I do not want to touch anything on the outside of this tray because it has been touched, but I can go inside, it's all sterile. And I can put all of my supplies out for the dressing change. With this is going to be, don't drop below your waist, this is just going to be a garbage that I can place at the patient's legs so that when I'm cleaning it, I can have some things to toss that into without reaching over things. So I've got that there, and I'm gonna unload all my gauze. And comes first with some scissors for rebandaging, things to measure, and all of that. So I'm gonna take my saline, and I'm gonna date, time, check everything, the expiration, when I used it, label everything on this. And I'm gonna pour it into my big container, and I would not have been leaning over this because that's no bueno. And I can open my saline. Don't reach over anything, pour it in there so that I have something to wet my gauze in. When you do that, you wanna make sure that none of the water or the saline slops onto your tray or your sterile field, because then it makes it not sterile. So this is going to stay in my line of sight the whole time. I'm not going to do any leaning over the materials that I don't need to. And I'm just going to start by grabbing a few of my 4x4s, and you can take these in here and you're going to get them wet and wring them out so that when you can start cleaning the patient's wound. And when you're doing this, be gentle around the edges. This is going to stay in my line of sight. I'm going to clean from the inside, the wound, working my way out and just wiping away all of that nastiness that's built up and making sure she's okay and not feeling any pain. Don't reach over the wound, but come around and try and just get that washed up on the other side. Don't get gunk and stuff inside the wound, and don't rub on the skin that's too close inside the wound because it will just irritate and promote the breakdown. So I have done this until the bandage is all the way, or until the wound is all the way clean. So I've dipped again, and I'm gonna just really make sure I wash it away, get all that crap away gently because she's probably not liking the feeling of this. Don't reach over the wound. I wiped all of this away, and I need to measure it. So without measuring it, I think I actually would have measured it before I cleaned it. When you measure your wound, don't touch the patient's skin or wound. You're going to do length, width, and depth. So I wouldn't have touched her with my gloves, sorry. On this, I would just kind of hold it above her, and I would say this looks like it's about 13.5 centimeters. And then you're going to go at the widest part of the wound, and it looks like it's going to be, and I would not have touched anything, it looks like it's going to be about 3 centimeters. So I'm gonna, if somebody's in the room with me, I'm gonna have them write that down. I would dispose of this because it's been in proximity of her nastiness, or her, I'm sorry, her wound. And then I'm gonna do the depth. I'm gonna remember all of those measurements. You go in and try to go in as close to the bottom of the wound and measure I'm sorry, I wouldn't have done that. Measure how far it is up, and this one looks like it's about 3 centimeters. So I would dispose of that, have a note, somebody take note or remember what I've done. So now that that's all clean, I'm going to, and I've measured it, I'm going to, I want to do the wet to dry packing, which is just going to consist of me taking these, and it's okay to take and kind of spread them out so that they go the length of the wound, and you get this wet, and you don't want to have this touching the outside of the wound because it can just promote breakdown, but I wouldn't be leaning over all of this either, and I wouldn't have the sniffles either. So you're going to take this, and this is not, honestly. So with this, you're going to take it out. I shouldn't have crumpled it up, but while it's not crumpled up, you want to just kind of start it at the very base of the wound and tuck it in there. Don't push it in there. Use one of the little Q-tips, and you can use those to help direct that wound packing back into the wound. So you're going to do this with the wet and like that, and then you can come over here. I would throw this in away, and I would do another one to get it full. So I'm going to get this in wet, scrunch it out. And on the video, Joy ran out of these, and she did cut up some of the rolled gauze and use it if you need more. So you can do that too, just depending on how much the wound needs. So you'll go in here and get your other Q-tip, making sure nothing gets wet, touched, or anything like that on your sterile field. Come in and do it again. And so that is only inside of the wound, not on the outside. So I wouldn't have pushed that in with my hand. I would just use my little Q-tip. Biohazard bag with all my other materials. This is where I would probably use some of my rolled gauze. Actually, I'm going to just put this as a dry one, and I can place this back over the wound right here, and then I'll do the same thing with this one and pat this one over the wound here. And so I've got it covered up. I'm going to take and use my ABD pad, and with this I'm going to place it on the top. I wouldn't have done that, on the top, and just kind of set it on there gently. So now that this is covered, I do not need to keep my sterile gloves on anymore. And I still want to stay as sterile as possible, but to use the tape, it might be hard. So I'm going to, I would have moved that up a little bit. I'm going to remove my gloves and put them in the biohazard bag, and I'll use my tape to adjust her. And this whole time I would have been assessing to see how she's feeling, if everything's going okay, how she feels about the procedure as well as how it's gone and how things are progressing. So this is now going to go on her to tape that bandage down, of course, and like so. Try not to do it in places that's going to be super sensitive to take off later. And so, whoopsies, what'd I do? Tape foul. What'd I do? Okay, so now I have pulled off another strip of tape. Gosh, and I'm gonna do that on all 4 sides. You gotta be kidding me. Okay, so I pulled that off and I have taped it on all 4 sides, just right along the border. I would have made sure that the skin is dry on the top before I put that ABD bandage on. I've taped all 4 sides of this to the patient's bandage, and then I would just cover her up again and just make sure that that felt okay for her. I can put some gloves back on now. I'm going to wash my hands and I'm going to put some gloves back on now because I'm going to take care of all my materials and dispose of them. So I can leave her environment clean and the way that she would want me to. And I'm going to make sure that she's in a safe position again. I would have lowered the bed rails while I was doing this and standing right next to her. But I would just put those up according to how she wanted it. If she was comfortable at this, which I'd leave her in the safest position possible according to this patient, which would be just probably make sure it's low, that there's not any things in the way or anything like that. So I can clean up my materials, and I would have thrown all of this stuff away. The biodisposable, biohazard crap thing, sorry. And she's comfortable, and then I would go out and I would chart and document everything that I did and saw and heard.